Welcome to Global Health Hub. This channel is purposely created for health education. Subscribe to our channel for more health videos. Thank you. A stroke, also known as a cerebrovascular accident, CVA, is a medical condition that occurs when the blood supply to part of the brain is interrupted or reduced, leading to damage or death of brain cells. Strokes can be classified into two main types: ischemic and hemorrhagic. Ischemic stroke. It is the most common type of stroke, accounting for about 85% of cases. It occurs when a blood clot or plaque buildup blocks or narrows an artery, reducing blood flow to the brain. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain ruptures and causes bleeding into the brain tissue or the spaces surrounding the brain. Transient ischemic attack. TIA. A transient ischemic attack, often referred to as a mini-stroke, is a temporary interruption of blood flow to the brain. It produces stroke-like symptoms that typically last for a short period, a few minutes to a few hours, and then resolve without causing permanent damage. TIAs should be taken seriously as they can be warning signs of an impending stroke and should prompt immediate medical attention. Causes. Ischemic stroke. The common causes of ischemic strokes are thrombosis, formation of a blood clot within a blood vessel supplying the brain. Embolism, a clot or plaque fragment that travels from another part of the body and blocks a brain artery. Hemorrhagic stroke. The causes of hemorrhagic strokes include intracerebral hemorrhage, bleeding within the brain caused by the rupture of a blood vessel. Subarachnoid hemorrhage, bleeding between the brain and the thin tissues covering the brain's surface. Symptoms of stroke. The symptoms of a stroke can vary depending on which part of the brain is affected. Common signs and symptoms include sudden weakness or numbness on one side of the body, often in the face, arm, or leg. Trouble speaking or understanding speech. Confusion. Difficulty with comprehension or memory. Visual disturbances, such as blurred or double vision. Severe headache with no known cause. Loss of balance or coordination, dizziness. Diagnosis. When a stroke is suspected, prompt medical evaluation is crucial. Doctors may perform various tests and procedures to diagnose and determine the type, cause, and severity of the stroke. These may include physical examinations, brain imaging tests, such as CT scan or MRI, blood tests, and other specialized tests. Predisposing factors. Risk factors for stroke include high blood pressure, hypertension, smoking, diabetes, high cholesterol levels, obesity, physical inactivity, atrial fibrillation, an irregular heart rhythm. Family history of stroke. Age. Risk increases with age. Gender. Men have a higher risk. Certain medical conditions, e.g., sickle cell disease. Previous history of stroke or transient ischemic attack, TIA. Treatment. The treatment of stroke can vary depending on the type and cause. For ischemic strokes, treatment focuses on restoring blood flow to the affected area of the brain. This may involve administering clot-busting medications, thrombolytics, or performing a procedure called mechanical thrombectomy to remove the clot. Hemorrhagic strokes require specialized treatment to control bleeding and reduce pressure on the brain. Supportive care, rehabilitation, and ongoing management of risk factors are also important components of stroke treatment. Prevention. Healthy lifestyle. Adopting a healthy lifestyle can significantly reduce the risk of stroke. This includes regular exercise, maintaining a healthy weight, eating a balanced diet, limiting alcohol consumption, and avoiding smoking. Managing medical conditions. Treating and controlling medical conditions like hypertension, diabetes, and high cholesterol can greatly reduce the risk of stroke. Medications. In some cases, medications such as antiplatelet drugs, e.g., aspirin, or anticoagulants may be prescribed to prevent blood clots from forming. Addressing risk factors. Identifying and addressing individual risk factors, such as quitting smoking or managing atrial fibrillation, can help in stroke prevention. Regular checkups. Regular medical checkups can help monitor and manage risk factors, as well as detect any underlying conditions that may contribute to stroke risk. Rehabilitation. Rehabilitation. Stroke rehabilitation aims to help individuals regain lost abilities and maximize their independence. This may involve physical therapy to improve strength, coordination, and mobility, occupational therapy to relearn daily activities, speech therapy to address communication difficulties, and other specialized therapies based on individual needs. Complications of stroke can vary depending on the severity and location of the brain damage. Some common complications include paralysis or weakness on one side of the body, difficulty speaking or understanding speech, memory loss or cognitive impairments, emotional and behavioral changes, swallowing difficulties, problems with balance and coordination, chronic pain, deep vein thrombosis, blood clots in the legs, pulmonary embolism, blood clot in the lungs, depression and anxiety. 6. Long-term outlook. The long-term outlook and recovery after a stroke can vary widely depending on factors such as the severity of the stroke, the area of the brain affected, and the individual's overall health. Some people may experience significant recovery and regain most of their lost functions, while others may have long-term disabilities. Rehabilitation, ongoing management of risk factors, and support from healthcare professionals and caregivers play important roles in the recovery process. It's worth noting that ongoing research and advancements in stroke treatment and prevention continue to improve outcomes and quality of life for individuals affected by stroke. If you or someone you know experiences symptoms of a stroke, it's crucial to seek immediate medical attention by calling emergency services or going to the nearest emergency room. Time is of the essence in stroke treatment, as early intervention can help minimize brain damage and improve outcomes.